Moving towards another topic, so let's start. Bismillahirrahmanirrahim. So basically, it is actinomycosis. Actinomycosis. Actinomycosis is basically a chronic, means it is a very gradual, separative, means the pus formation, and polymicrobial infection, means multiple microbes are involved, which is caused by endogenous bacteria, means the bacteria which is inside of us, like actinomyces, especially Actinomyces israeli is mainly a predominant bacteria that cause this. Basically, Actinomyces israeli are anaerobic gram-positive bacteria that are normally commensals in the oral cavity as well, means they actually live in harmony. Actinomyces viscosus is also the second most common causative organism. You can see here the filaments of Actinomyces. The clinical features, the traumatic incidents such as like extraction, the patient suffers or periapical infection, yeah, pericoronitis, means like a patient has done recently extraction or any periapical infection or pericoronitis around in a infected tooth can be a predisposing factor, means extraction, periapical infection or pericoronitis. Following infection, there is also an acute inflammatory reaction. Soft tissues may have a display swelling and intense pain. Following this pain, infection resulting in an osteomyelitis. The patient also suffers from osteomyelitis. Okay. Severe bone destruction is one in this case. Then periostitis means the inflammation of the bone. Soft tissues abscess means there is abscess formation because it is suppurative, nodular looking. Nodule is formed and draining sinus tracts, means it is a lumpy jaw disease. Lump, the lump is formed here, the lump is formed in your jaw. Okay. And multiple sinus tracts. Exudate contains small yellowish clinical visible granules, means that the pus contains small yellowish clinically visible granules, which are called sulfur granules. They are classified colonies of actinomyces. Means the classification has been occurred. So okay, there are granules which contain sulfur, and then the colonies are calcified. You can see here this. The histopath mainly display the central cavity with a purulent exudate. Okay, means in center there will be actually pus. The exudate contains calcified colonies of filaments, means in this they will have actually the calcified colonies of filaments bacteria. The central area is slightly hematoxylin positive. The central area will the positive for hematoxylin positive and amorphous looking, means irregular. The periphery consists of filaments. In the center, we have said there will be pus. Okay, and the and slightly contain hemooxytylene positive amorphous looking, but in the periphery the filaments organelles are arranged in sunburst pattern. Okay, the in periphery the filaments are arranged in sunburst pattern and filament stains with eosine. The filaments has eosine stains. The purulent exudate contains neutrophils. So you can see neutrophils, the red patterns on the periphery like sunburst appearance, calcified bacterial colonies which is present also here. So on the center there was pus, and on the periphery there was actually filaments. You can see here. You can do also local debridement and drainage of that pus, penicillin for minimum for 10 days, and you can also give in severe cases long course of IV administered penicillin till the patient is not cured.